Good evening, folks. This evening's topic B is we're discussing understanding healthcare proxy. Okay, I'm going to explain to you what a healthcare proxy is. Okay, here we go. A healthcare proxy is a legal document naming someone you trust to make medical decisions for you if you cannot. Having one ensures your treatment preferences guide care and prevents family conflict or court intervention. What a healthcare proxy is. A healthcare proxy, also called a health care agent, surrogate, or durable power of attorney for healthcare, is a legal designation that lets a chosen person make medical decisions for you when a doctor determines you cannot speak for yourself. Okay. Further explanation to follow. This document is one form of an advanced care directive. And can work together with a living will that records specific treatment wishes. What a healthcare proxy can and cannot do. A properly appointed proxy can access medical records, consent to or refuse treatments, and communicate with clinicians on your behalf while you are incapacitated. State laws vary, but proxies often have authority over life-sustaining treatments, ventilations, tube feedings, transfers of care, and decisions about palliative or comfort care, though some specific powers may be limited by state statute. A healthcare proxy does not control your finances. A separate financial power of attorney is needed for money matters. Why it matters. Without a proxy, decisions may fall to clinicians, hospitals, policy, or court appointed guardian, and families can disagree during crises. Naming a proxy ensures your chosen person's decisions take precedence and that your values guide care. Advanced planning reduces stress for loved ones and speeds decision making in emergencies such as stroke, severe injury, or sudden illness. How to choose and set up one. Pick someone you trust who understands your values and can handle conflict. Consider backups in case your first choice is unavailable. Discuss specific wishes, preferences about life support, CPR, feeding tubes, hospice, so so your agent can follow them. Complete the correct legal form for your state, often called durable power of attorney for healthcare or health care proxy, and give copies to your agent, family, and clinicians. Risk limitations and practical tips. State law state law differences can affect what an agent may do. Check local rules or consult an attorney. Choose someone willing and able. Being a proxy can require difficult conversations and decisions. Keep documents current. You can change or revoke a proxy at any time while competent. Bottom line, naming a healthcare proxy is a simple, high impact step in advanced care planning that protects your wishes and spares your loved ones uncertainty. Start by talking with a trusted person, documenting your choices on the correct state form, and sharing copies with your medical team. A healthcare proxy is a legal document naming a trusted person to make medical decisions for you if you cannot. You need one to ensure your wishes guide your care, avoid family conflict, and prevent court appointed guardianship. Quick guide: what to decide first, who will act for you primarily, and backups. What values and specific treatments matter to you? Life support, feeding tubes, CPR, hospice. Where to store the signed form, and who should get copies? Agent, family, clinicians. These choices make the proxy effective and usable in any emergency. What a healthcare proxy does, in plain terms: a healthcare proxy, also called healthcare agent, surrogate, or durable power of attorney for healthcare, gives the named person legal authority to make medical decisions for you when a clinician determines you cannot speak for yourself. The agent can access the records, consent to or refuse treatments, and work with your care team to follow your wishes. Why it matters. Concrete benefits. Protects your preferences. Your agent's decisions take precedence over others when you're incapacitated. Reduces family conflict and delay. Without a proxy, hospitals may follow default policies, involve multiple relatives, or require a court guardian. Speeds decisions in emergencies. Named agents can act immediately. Important in strokes, accidents, or sudden illness. How to choose and prepare an agent. Pick someone you trust and who knows your values and can handle stress. Consider emotional resilience and availability. Talk through scenarios, e.g., prolonged life support versus comfort care, so they can represent your wishes, not their own. Complete the correct state form. Names vary. There of a power of attorney for healthcare proxy, advance directive, and give copies to your agent, family, and medical providers. Limits, legal details, and variations. State laws differ. Some states limit specific powers, e.g., withdrawal of certain life-sustaining treatments. Check your state rules or consult an attorney. A proxy does not control finances. Use a separate financial power of attorney for money matters. You can change or revoke it at any time while competent. Name alternatives. Alternates in case the primary is unavailable. Risk trade-offs and practical tips. Risk. Choosing someone who disagrees with you, with your family, or lacks clarity about your wishes can create conflict. Mitigate by documenting preferences in a living will and discussing them openly. Risk. If you pick a healthcare provider or facility employee, some states prohibit that choice. Confirm local rules. Actionable steps. Sign the state form Give copies to your agent and clinicians. Store a copy in your medical record if possible, and review every few years after a major life change. Bottom line, naming a healthcare proxy is a simple, high impact step that ensures your medical values guide care when you can't speak for yourself. Do it now. Document your wishes and tell the people who will act for you. Okay, guys, that is your B for tonight. I will be back on shortly with another show. See everybody shortly.